All right. So, welcome back, everybody, to the Mindful Clinician series. I'm Alex Wilson, accredited mental health social worker and the Director of Mindful Recovery Services up on the beautiful New South Wales Central Coast. Happy Friday to you all. Today, our topic is going to be metta and loving kindness. So, if you've done some mindfulness before, you'll recognize these terms. If not, don't worry about it. I'm going to talk you through. So let's just start to settle in here. Last week, we talked about mindfulness more generally, and we started talking about, noticing thoughts, emotions, body sensations, and building greater awareness. And today, we're going to build on that by introducing another type of mindfulness practice, which is called loving kindness or metta practice. And I want to frame this slightly differently. Loving kindness practice can feel lovely, but it's not only something that's nice to do, it has a lot of relevance for our work as helping professionals and how we can show up for clients, and really importantly, how we sustain ourselves in working with people in pretty intensive ways. So last week I was talking about how mindfulness involves building awareness. And I often talk about mindfulness, two wings of the dove. And if you've listened to Tara Brach, who's an amazing mindfulness teacher, she talks about this two wings of the dove. And the first wing in mindfulness is awareness. The second wing, that is much harder, is non-judgment. But it's actually both of these wings that bring the most benefits from mindfulness. But usually the path is we build awareness first, and we can see this in our clients as well. We can help them build awareness, and then the non-judgment takes a little longer to develop, right? The ability to notice what's happening inside ourselves and outside of ourselves without immediately reacting, judging, or trying to fix it or push it away, right? That's really the skill that we're trying to build. From a neuroscience perspective, being able to build awareness and non-judgment helps to strengthen our attention, our regulation, and particularly in the prefrontal cortex, yeah? Reducing reactivity in the threat systems, especially the amygdala. So over time, mindfulness helps us build awareness and reduced reactivity, right? Reduced judgment. Um, we know in our clinical work with clients, patients, consumers, that awareness alone is not always enough. If we only build this one wing of awareness, it's a great start, it's an essential start, but we want to go further than that and build that second wing. Because otherwise, what can happen is that people just become incredibly aware of their distress and then they're just kind of in it. So they do need to be aware of their distress in order to know what to do with it, but we don't want to just leave them in just awareness, right? And this is the same for us. We want to have great awareness of what's happening for us, but then we want to go that extra step and be able to do something with that to make it more manageable, to make it softer, more bearable, whatever that might be. And this is where loving kindness practice fits in, that second wing. Um, so yeah, we want to make sure that we're not just becoming highly aware, but we're becoming highly aware and able to practice non-judgment and loving kindness. This is great when we have to make decisions clinically as well. It's really helpful when we need to stay present with stuff that's quite intense. And it really helps us in the therapeutic relationship to be able to have loving kindness towards ourselves and our clients is what creates that lovely attunement in the therapy room or whatever the working relationship looks like for you. So, thinking about loving kindness practice as a form of mindfulness, but with an added ingredient of intentionally directing care, either to self or others. And in a loving kindness or metta practice, we use phrases such as, may I be happy, or may you be happy. May I be calm and safe. May you be calm and safe. This isn't about forcing emotion or being overly soft or avoiding, clinical realities, but it's about training our attention and intention. So we're relating to our experience and the client's experience with this touch of care. Clients, when we're working with clients, again, whatever you call them in your work, when we're helping people, clients are not just responding to the interventions that we're doing or the formulations that we're making. They're actually responding to how we are with them. Yeah, what it's like to be in our presence. And if our internal state is pressured or self-critical or too outcome focused, sometimes that can even be felt, right, in that therapeutic relationship. So, really lovely to have some tools to be able to settle that. And again, from a neuroscience perspective, loving kindness really activates systems linked to care, safety, connection. This is incredibly helpful if we're working with people where there's trauma, particularly complex trauma in their background, because we are a trigger for them. Yeah. If somebody has been hurt by a person that they trusted, we are a huge trigger for them because here they come into our room putting all this trust in us, having this really intimate emotional relationship. So, loving kindness allows us to really hook into those care, safety, and connection pathways. It's twofold, right? So, for us as clinicians, this kind of practice can help us increase our emotional regulation capacity. It can help us be cognitively flexible, especially if we're working with people where it's kind of tough. Yeah. In my work, I work a lot with people where there's lots of difficult behaviors and risky behaviors, and sometimes, really difficult behaviors that are hard to understand, even as a therapist sometimes. So having that ability to have that flexibility and tap into loving kindness allows us to continue that sort of unconditional positive regard. It also allows us to tolerate uncertainty, to sit with things that feel difficult with compassion. This is super important for complex presentations, chronic risk, and if you're doing relational work, which I think most of you are. Now, for our clients, this is great too, right? Loving kindness practice can be good for them. It helps them to be more regulated. It helps them to be more steady. It helps them to feel safer potentially around people when people are their trigger. So we're helping reduce arousal in the therapeutic relationship, increase a sense of safety, and get a greater sense of engagement through that. Now, as helping professionals, we spend a lot of our time directed to analyzing risk and problems, what's not working and what needs to change. And we absolutely need to do that. That's really appropriate. But also, what can happen is that our brain over time gets really tuned in to those things, to identifying threat and problems. This, for helping professionals, can sometimes lead to problems like burnout, compassion fatigue, emotional exhaustion, or even, a sort of a pushing away, a distancing from clients, or even negative views about clients. Or sometimes we go into, an over-fixing mode. Sometimes that can be the signs that we're heading towards burnout and compassion fatigue. So rather than seeing loving kindness as something extra that we might do, we can start to understand it as a really core clinical skill. It allows us to stay present without becoming overwhelmed, maintain our compassion without losing boundaries, really important, and to tolerate and sit with distress without needing to immediately fix it. So, this is allowing us to work with clients from a place of capacity rather than constant depletion. Yeah. Um, there's some shifts that clients can also experience when we teach them a practice like loving kindness. It can help them shift from self-criticism, which might be very intense, to a more supportive, compassionate inner dialogue. That's the goal of it. It can help them build tolerance for difficult emotional states and develop a sense of internal safety, almost like a bit of a self-soothing place where they can go and connect whenever they need it. Again, super helpful for people that have experienced trauma or are involved in behaviors like self-harming, chronic shame, things like that. Loving kindness can be a really core skill for them, but it does take time to grow. So, what I want you to understand as we start to move into our guided practice today is that mindfulness overall helps us notice experience and build awareness. But loving kindness is going to help us to build the non judgment and the capacity to really be with difficult things for longer. Um, and in our clinical work, that shift is not small. It can really change how we show up, how we think, how effective we can be. And this can also have a huge impact on our clients, just by demonstrating loving kindness, but also potentially teaching them how to do a practice like we're going to do today. Okay, so I'd like you to get comfortable. We are going to move into our guided practice now with all of that in mind. And go ahead and begin by just finding a comfortable position. Whatever that is for you, wherever you are today, a comfortable position, sitting in a way that feels supported and alert. If you'd like, you can close down your eyes or simply soften your gaze somewhere in front of you. Bringing your attention to the breath, not trying to change it, just noticing it as it is. Allowing your body to settle, softening your shoulders, relaxing your jaw, letting your face just be at ease. If you notice your mind is busy, that's completely normal. Nothing to fix there. Just gently returning to your breath each time you notice that your focus has drifted. You might like to notice that you are stepping out of doing mode and simply allowing yourself to be present for the next little while. Nowhere else to be, nothing else to do, just for the next little while. Now go ahead and bring into your mind someone that you care about deeply, where the love comes naturally and easily. This could be a loved one, a child, a friend, even a pet, an ancestor, a mentor, a being where the love is easy, unconditional, and simple. Take a moment to picture them, their face, their presence. You might imagine them sitting in front of you, simply sensing them here with you now. And now in your mind, gently offering them some phrases of goodwill. May you be safe. May you be well. May you be at ease. May you be happy. Letting the phrases land in whatever way they do as you send these wishes to your loved one. May you be safe. May you be well. May you be at ease. May you be happy. Just noticing what it's like to intentionally direct your care to this being that you love. Noticing what you might feel inside of you as you send these messages to them. May you be safe. May you be well. May you be at ease. May you be happy. Just noticing what's there for you as you do this, as you connect with this loving kindness. Now, go ahead and say farewell to your loved one, allowing their image to fade from your mind, knowing you can always bring them back anytime you like, wishing them well as they go on their way. And now, bringing to mind someone more neutral in your life. Maybe someone you don't know very well or you don't have strong feelings about. This could be someone you see at work, your local barista, someone in your broader professional world, or a family member that you don't know very well. And taking a moment to picture them. Doesn't matter who you choose, just any neutral person. Maybe someone that you saw today. Picture them in your mind. And remembering that this person has a life as complex as yours. They too experience stress, hope, difficulty. And like all of us, they want to be safe, to be okay, to avoid suffering. And now offering these same phrases in your mind towards this neutral person. May you be safe. May you be well. May you be at ease. May you be happy. Just noticing what it's like to extend care beyond your usual circle. May you be safe. May you be well. May you be at ease. May you be happy. Extending this loving kindness to this neutral person, just human to human. May you be safe. May you be well. May you be at ease. May you be happy. Just noticing what it feels like to sit with this sending of loving kindness to this person. Now go ahead and bid them farewell. Allow them to move out of your awareness. And now gently shifting the focus onto yourself. You might imagine yourself sitting here or simply sensing your own presence. Connecting with the you that is here and now, just in this moment. And now offering these same phrases to yourself. May I be safe. May I be well. May I be at ease. May I be happy. Just noticing what this is like. For some people, this can feel difficult. You may notice some resistance to sending yourself well wishes, or you may not. Whatever it feels like for you, just continue in this way, saying to yourself, may I be safe. May I be well. May I be at ease. May I be happy. You may like to even place a hand somewhere on your body to help you feel connected. Maybe a hand on your chest, over your heart, or on your belly. And as you say these phrases to yourself, imagine them being sent through your hand into your being. May I be safe. May I be well. May I be at ease. May I be happy. Remember, as helping professionals, this is the same system we draw on in our work, our internal self. May I be safe. May I be well. May I be at ease. May I be happy. May I be safe. May I be well. May I be at ease. May I be happy. Just noticing if you can connect with a sense of loving kindness towards yourself, even just for a moment. Sending that unconditional love into yourself. The same care that you send to the people you work with and to the people that you love. May I be safe. May I be well. May I be at ease. May I be happy. Now let's shift our focus away from ourselves. And we're going to try one final thing to stretch ourselves just that little bit more, to see if we can connect just that little bit further with love and kindness. If it feels okay, bring to mind someone who you find difficult. This might be someone you're feeling frustrated with at the moment, someone who challenges you or has been challenging you, a client, a colleague, a family member. And as you bring into your mind the image of this person, just noticing what arises in you without judgment. If this feels too intense, you can always return to thinking of yourself or a neutral person or a loved one. But if you're able, see if you can hold this more difficult person in your awareness. And remembering, this person also wants to be safe. They also want to be well. They also want to be happy, even if their behavior makes that really hard to see sometimes. And now offering gently to this difficult person, may you be safe. May you be well. May you be at ease. May you find a way out of suffering. This isn't about approving of behavior or forcing forgiveness. It's simply about loosening that grip of threat, relating differently from a place of universal compassion. May you be safe. May you be well. May you be at ease. May you find a way out of suffering. You may notice that it's more difficult with a difficult person to send these well wishes. And just acknowledging whatever this feels like for you, it's okay. There's no way to do it perfectly. We'll just continue sending the wishes. May you be safe. May you be well. May you be at ease. May you find a way out of suffering. Now letting go of the image of this difficult person in your mind, allowing that to drift away and simply coming back to yourself, back to your attention on your breath. Or if the breath doesn't feel like a good anchor, simply the sensation of your feet on the floor or your back against the chair. Just taking a moment to notice what's here now. What is present for you just in this moment of time? Reflecting on what this practice has been like to connect with feelings of loving kindness, whatever this was like for you. And perhaps considering how this sort of practice might be something you bring into your work, into small moments between sessions, how you relate to others, and most importantly, how you relate to yourself. Knowing that at any time you choose, you can connect with these feelings of loving kindness. It's always available to you. You might like to take some cleansing breaths now as we come towards the end of our practice, perhaps just allowing a couple of deeper cleansing breaths. You might like to move your body in any way that feels good for you as you start to bring your attention back to the chair that you're in, to the space around you. Gently bringing your awareness back and opening your eyes when you're ready.